Let me thank Kishore and Yatish for giving me this opportunity this evening. How do you know you might have a heart problem? For example, what are the red flags? What are the symptoms of a sudden cardiac arrest? Some people may experience a racing heartbeat. My heart is beating very fast. Why is my heart beating very fast? You need to evaluate yourself with your doctor. I'm feeling dizzy. What is the reason as to why I'm feeling dizzy? And an unexplained fainting. A young boy or girl just faints. You need to find the cause. We already mentioned the family history of sudden family death. In over half the cases of sudden cardiac arrest, it occurs without any prior symptoms. That means in 50% of the people, they do not have any symptoms and it will not be identified. What are the risk factors for heart attack? Cardiac arrest is different from heart attack. We'll go through that again, but they tend to overlap. You have an ischemia of the heart that itself would lead to ventricular fibrillation or ventricular tachycardia. So it's important for us to know what causes this or what are the risk factors. You all know high blood pressure, high sugar, high cholesterol, obesity, lack of exercise, unhealthy diet, mental stress, excess alcohol, and most importantly, it's smoking. Smoking is the #1 killer. So you should always discourage your young not to smoke. If they begin to smoke, you have to get help to get them de-addicted to tobaccos. Now, this is the picture of a normal artery, and the artery where the fat has deposited inside the blood vessels. Now, if you have risk factors like diabetes, hypertension, smoking and cholesterol, fat tends to deposit inside the blood vessels. When the fat is deposited inside the blood vessels, the blood flow through the plaque is restricted. Once the blood flow through the plaque is restricted, there is lack of oxygen and nutrients to the distal part of the heart, and the heart will suffer. What we call as there is a mismatch between the supply and demand. When you have this mismatch, the part of the heart suffers. Initially, the heart would present with chest pain and so on, and if you ignore this chest pain, dizziness, sweating and so on, you will land up with a major heart attack. Now, this is what happens. The main blood vessel is completely cut off with this plaque, which we call it as a fat deposition inside the blood vessel, and that the bluish or the purplish area of the heart has died. Heart is one of the organs. Once heart and the brain are the two organs, if that part of the heart or the brain dies, it will never regenerate, it will never regrow. That is why it is important to prevent a heart attack, it is important to prevent a stroke, because once the damage is done, the muscle is lost. And also, most importantly, if you find that somebody has got a heart attack, it is important to take them to the nearest hospital and get them treated as soon as possible, because time is muscle. The earlier the treatment is given, the earlier you can save the patient. What are the common symptoms of chest pain? You all know you could have nausea or vomiting. Shortness of breath is very common. Doctor, I cannot climb a step of stairs. ನನಗೆ ಒಂದು ಮೆಟ್ಲು ಹತ್ತಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ನನಗೆ ಉಸಿರು ಕಟ್ಟುತ್ತೆ. The discomfort in the chest. I feel as if somebody is sitting on my chest. A crushing, a squeezing sensation, and all these symptoms should not be ignored. Cold sweat, choking, difficulty, numbness in the hands, pain in the neck, jaw, arms, shoulder. All these are signs of a cardiac problem. At the same time, I just want to warn you that any pain in the chest is not necessarily a pain from the heart. So do not panic. Pain in the chest could be because of acidity or gastritis. It could be because of the muscle, the bone, the lungs, and the rest of the organs that are within the chest. So it's important to not to panic. If anybody in the house says, look, I have a lot of chest pain, please take them to the nearest doctor, or it's better you take them to the nearest cardiac center. If only a doctor will be able to differentiate whether this is a cardiac problem or a non-cardiac problem. Because most of the time we assume that this is acidity and we give them some musru or curds or something and let them go to sleep and they will never wake up. So pain from a heart attack doesn't go away with antacids, drinking water, or taking any deep breaths. You have to, it could be angina or heart related. Technically, there is a technical difference between sudden cardiac arrest and heart attack. The amount of blood that gets ejected from the left ventricle becomes small and the cardiac output drops. When the cardiac output drops, you feel dizzy, you get chest pain, you cold, clammy, sweaty, and you tend to faint. So you do not want a fast heart rate. That's why we always tell, cool down, calm down, keep your heart rate as low as possible. In the first few minutes, there's great concern, the blood flow to the brain will be reduced. So drastically, the patient will lose his consciousness and death will follow. The yellow thing you see here is the electrical system of the heart. Any problem to the heart, electrical system, it could be an ischemic problem, that is lack of blood supply to the heart muscle, or it could be because of age-related, and there are multiple factors. It could be a congenital problem and so on. It will affect the conduction system, it will make the heart irregular, and it will throw into all kinds of dangerous rhythms called ventricular fibrillation and ventricular tachycardia, where the cardiac output drops and the patient will faint straight away. This is how a normal conduction system looks like, and in the next figure you see how the ventricles skewer and the rhythm is so erratic. Abnormal heart rhythms like ventricular fibrillation are called arrhythmias, where the heart beat is very disorganized and irregular. You know, the heart normally beats luck tap, and it is very regular. The moment the heartbeat becomes irregular, the cardiac output drops. On top of it, if the heart doesn't pump, your blood flow to the aorta and the rest of the vein drops. And these are all life-threatening arrhythmias. And which one of the most life-threatening is ventricular fibrillation. When this occurs, the heart is unable to pump the blood and death will occur within minutes if left untreated. That is why it is important to recognize the problem and take the patient to the nearest hospital as soon as possible. It is totally disorganized. When the heart is fibrillating, imagine when you say fibrillation, it's like a cure or a muscular fibrillation. When you're shivering, what happens? The muscle just quivers. It is not pumping. The function of the heart is to pump. If the heart cannot pump, the blood does not get ejected from the left ventricle. So, how do you treat a cardiac arrest? If you identify the cardiac problem immediately, and particularly in a hospital situation, there's a 90% chance that you could save the patient. As time progresses, the outcome decreases drastically. So it's important, first, call for the emergency help. You find somebody has collapsed at home, always get help. That is the most important thing you need to do. Call for help, call for an ambulance, take him to the nearest hospital as soon as possible. In India and abroad, you'll find a lot of what's called as AED, an automated external defibrillator. If it is available, please make use of it. I'll talk to you about it once later on. Now, CPR or cardiopulmonary resuscitation, how do you do a CPR? First, get help, call for help, look for signs of life, easy alive or easy dead. The first thing you do is tap on his shoulder and say, "Are you okay?" If he responds, then you know he's awake. If he is not responding, then you have to start the CPR. The basic CPR you can do anywhere is you can do 30 compressions and give 2 breaths, and if possible give an airway. But 30 compressions and 2 breaths are important. Once the ambulance arrives or he reaches the hospital, because I told you it's an electrical problem, they will defibrillate the heart. They will give an electric shock to the patient and they will desynchronize the irregular electrical conduction that's going on in the heart. And once that is done, the heart might start beating depending on how long the heart has been arrested. If you bring to the hospital early, there's a good chance that the patient could survive. If you delay, he may not be able to survive this in spite of defibrillation and cardiopulmonary resuscitation measures. If you go to a railway station or any malls or a airport, you'll find a board called AED. There's always an arrow mark which shows AED is available. AED is a very simple system. It has got only 3 steps, which is mentioned there. If you could see here, there's a green dot and a blue dot and a red dot. It will tell you what exactly to do. If you find somebody unresponsive, you apply the plaques in the front and the back of the chest and just leave the AED to do rest of the work and keep away from the AED. The AED will detect the rhythm, and if he thinks it is a shockable rhythm, the AED will please keep away from the patient. I'm going to shock, and it will shock. We have about 8 of these AEDs in our hospital. I think we have the maximum amount of AEDs anywhere at JSS Hospital. And you'll find these things, so don't hesitate to make use of these AEDs wherever you go. I think it's available in few of the malls here in Mysore also. The other thing that we could use to help the heart is an ICD, an implantable cardio defibrillator. You would have heard about pacemakers. It is very similar to a pacemaker, but has got more functions than pacemakers. Now, sometimes if you are at high risk, the sudden cardiac death, your doctor usually will suggest you to avoid competitive sports. If you have a cardiac problem, doctor will say, fine, you can have a normal activity, but not competitive sports. This tiny device implanted in your chest like a pacemaker, continuously it will monitor your heartbeat. If a life-threatening arrhythmia occurs, the ICD will deliver electric shocks. Now, how do you know who has got this problem? It is important to screen all the young men, but screening young men is a Herculean task. So what we can do is, if somebody has got a family history of sudden cardiac death, we can definitely screen them, or people who has got risk factors for the condition that could lead to sudden cardiac death, we can screen them, because screening itself will cost. It cannot be done on a routine basis because screening costs money. When we talk about risk factors, I want to stress that you can have, what the worst thing you can have is use tobacco. Tobacco in any form. It could be smoking, cigarettes, bidi, snuff, chewing, whatever it is, tobacco in any form is harmful. And it is very important to educate our youngsters that how bad tobacco is. Water is life. You have to stay well hydrated. Particularly if you're going to the gymnasium, you have to hydrate yourself pre, during and post the gymnasium, because water is very important for your heart and the circulation. Diet. It's better you all go into a plant-based diet. That means you are not consuming even eggs, chicken, meat, anything. A plant-based diet reduces your heart risk by 40%. And all studies have shown that you are better off with a plant-based diet. Foods rich in potassium. Potassium is very good for the heart. Potassium is very good to bring down your blood pressure. These are the vegetables which has got high potassium content. A banana, tender coconut water, spinach, beans, any lime juice, avocados and so on.